Now, wow, how do I follow a health minister speaking about ME in Northern Ireland? Thank you very much. Really, really appreciate it. Um, right. Good afternoon and welcome everyone. My name is Joan McParland, founder and voluntary coordinator for Hope for ME and Fibro Northern Ireland. We are an all-volunteer patient-led charity supported by our family members and collaborating with global ME institutions since 2011. Before we convey the Northern Ireland situation for ME patients, I would like to say we are deeply grateful for the dedication of a handful of decision makers, some are here today, who have been working to bring change for ME patients in Northern Ireland for well over a decade. But let's look at why and how 2025 must be the year this change becomes a reality. Thanks to Robbie for hosting what I believe is his fourth awareness event for the charity and sticking with us. It's hard to believe that 7 years have passed since Robbie successfully brought the Chief Medical Officer, Professor Sir Michael McBride, to this very venue for our first Do No Harm conference. At that time, Sir Michael generously offered a sincere and heartfelt acknowledgement of the struggles faced by the ME community, and we will never forget his words. He said, no patient should have to fight for recognition, and the fact that many of you have had to do so is a matter of great regret to me. And trust me when I say that meant a lot, because until someone has experienced having not only to campaign for health services, but to fight to have your life-altering disease to be believed, one cannot fathom that extra layer of suffering faced with the stigma surrounding ME. Then how could anyone have foreseen what was to come? A pandemic that made those of us living with ME for decades shiver from our own experience of getting just a virus and knowing that huge numbers of people would be joining our ranks with what's being called long COVID, and the group within this long COVID label that is indistinguishable from ME. So instead of recovering from just a virus, millions with post-COVID ME have now joined us in our ongoing call for investment in research, access to effective treatments, and proper compassionate healthcare. Today we welcome Stuart Walker, Operations Manager at ME Research UK, who joins us to mark MER UK's 25th anniversary. Our connection to them runs deep, and we were privileged to have their founder, Dr. Vance Spence, here speaking in Stormont in 2014. MER UK exists to commission high-quality scientific biomedical investigation into ME. The charity has invested over 4.5 million biomedical research worldwide on 68 distinct projects, as well as 4 PhD-level studies. Sadly, no MER UK funded research has ever happened in Northern Ireland yet. So our Northern Ireland universities have a proud record of world-class research. Just imagine the impact if their talent and innovation were connected with MER UK's expertise and vision. So please, to academics here today, do make these connections worthwhile and have a chat with Stuart. And maybe even sign up for your free Breakthrough Monthly magazine, and do visit their website. So for this audience, we don't need to go into all the symptoms of ME, except to confirm it is a chronic multi-system disease affecting the brain, immune and energy production systems, and in its most severe form can be fatal. And research clearly demonstrates how misdiagnosis remains problematic and a distinct barrier to supportive healthcare. So today we are unveiling our new pop-up banners somewhere. This one here. Our message is simple to decision makers and healthcare providers to recognise, diagnose and support ME as we highlight the reasons and the urgency for early and accurate diagnosis of ME, save NHS resources, and, as we highlighted in our 2018 conference, to first do no harm. It is to be noted that in January 22, the new NICE guidelines for ME NG 206 was endorsed as applicable to Northern Ireland by the Department of Health, but unfortunately, patients are yet to see it implemented. The charity has been campaigning since 2011 for specialist ME services in Northern Ireland, and our hopes were briefly realised in 2018 when a consultant was successfully recruited to lead Northern Ireland's first ME service. It was a hard-won milestone, but that dream was short-lived, and what should have been a turning point became another devastating setback. But there is another potential turning point coming next month with the publication of the ME Full Reality Delivery Plan for ME, a cross-government initiative being launched in England. While this plan currently applies only to England, it sets a vital template and precedent for what could and should be achieved in Northern Ireland. A new study by the University of Edinburgh is indicating there are an estimated 12,500 adults and children with ME and post-COVID ME living in Northern Ireland. We must not be left behind. The delivery plan for ME centres on three core themes: research, attitude and education, and living with ME. Exactly what Hope for ME has been trying to address for 14 years. So what have we been doing in Northern Ireland? We have funded a Doctors with ME organisation project investigating into doctors' knowledge of ME. We have donated over £25,000 to biomedical and academic research institutions. We have hosted 17 major conferences, bringing expert clinicians and researchers from around the world to educate decision makers and healthcare providers in Northern Ireland. And we have and continue to work with Queen's University, Ulster University, HSC Clinical Education Centre, SPBG, Public Health Agency and NICON. And just a few years ago, we organised for a 1-hour ME clinical update webinar for healthcare providers, and it remains available on the GPNI website. And we offer patients a voice and support through our shared experiences of living with ME. We are a small grassroots organisation, therefore collaboration with bigger organisations is vital. We are one of 21 proud members of World ME Alliance from 26 countries and growing. This year, challenging the myths and championing the facts about ME. More information is available on their website. We are also associate members of There For Me, a fairly new organisation formed as a result of the predicted outcomes of the pandemic and calling for an NHS that is there for people with long COVID and ME. There For Me sum up the situation by stating, our experiences highlight systemic failures and the need to be addressed to restore confidence and ensure safety for these patient populations. This is not about individual clinicians, but about system-wide failings. Healthcare workers are being failed just as much as patients by not having the right tools or institutional support to provide appropriate care to long COVID and ME patients. So what are we asking here for today? We are calling on the elected representatives present to act on three critical priorities. Commission specialist ME services that follow the 21 NICE guidelines, ensuring care is multidisciplinary, biomedical based, and most importantly, to be accessible to patients, including the most severely ill and bed or housebound. 2, mandatory undergraduate education for ME for medicine, nursing and AHP students, and postgraduate training for all healthcare professionals. And 3, to champion public awareness campaigns that challenge the stigma, correct the misinformation, and reflect the true biomedical nature of this illness. And please sign our petition that will be circulating after the speakers. And please do read your leaflet, which I forgot to put out on the seats, on the ME history to understand the depth of our fight, described by a former science teacher, Carol Monaghan MP, in a Westminster Hall debate as one of the greatest medical scandals of the 21st century. And also learn about the circumstances surrounding the death of severe ME patient Maeve Boothby O'Neill and the resulting UK coroner's report on preventing future deaths. So finally, please take a moment to visit our severe ME visual display located inside the ambulance at the bottom of the steps of Stormont. The gate has been opened especially for us to walk down the steps today, and Minister, we haven't taken an ambulance out of service. It is owned by the Computer Hospital in Bessbrook, who use it for advertising their computer hospital. Okay. Yeah. Also in the Apron area until 5 p.m. today, there's a powerful opportunity for MLAs to meet with patients and families and to truly understand and learn what is at stake for the thousands of patients with ME in Northern Ireland. Our next speaker is Tara Anderson, who will share her pioneering Discover ME virtual reality research. Tara can now be officially added to the ME history books for having the first published research paper about ME that's come out of Northern Ireland. I think that deserves a wee round of applause. Following Tara, we have a presentation from Professor Tom Trinnick, OBE, and I want to take a moment to warmly welcome and acknowledge Professor Trinnick for joining the charity last year as another valued medical advisor. Throughout his long and distinguished career serving patients, Professor Trinnick has contributed to multiple Department of Health and area board committees. We are honoured to have his guidance as we push forward in our mission. So, Professor Trinnick is also going into the ME history books as the first Northern Ireland advisor that we have, because all the rest are from one from Galway University and two from England. So that's more for the history books today. So thank you very much. And don't forget to test out our virtual reality headsets here after the speakers. Thank you. I think that's it. No, prologue. In closing, I want to offer my sincere thank you to every single patient volunteer and to our family members who make it possible to do what we do and who care for us during the aftermath of using precious energy we cannot afford. And to our dedicated fundraisers, some who are here today, your efforts have been humbling. Thank you for believing in us and to bring much needed equality of care and justice for all ME patients in Northern Ireland. Thank you. Tara, it's you next, isn't it?